The Dryhootch Partnership for Veteran Health really came about as a process. The medical college has a big initiative to try to drive forward what we call Community Based Participatory Research. And that's the idea that we're integrating the healthcare system with community-based partners to kind of get research to be more grounded in people's everyday life. Dryhootch, especially at that time, was kind of the Wild West in some ways from our perspective, right? So things were happening here that didn't make sense from a traditional healthcare perspective. But the veterans really felt like they were having an impact on other veterans who needed care and who might not seek care from the VA or from a traditional healthcare provider.
I don't like institutions. Zeno, he worked at an institution. We're peer support. That's what Dryhootch's mission really is, providing peer support for veterans in transition, wherever that transition may be.
Mark Flower and I were meeting all the time, pretty much, a couple times a week. The partnership was meeting at really a neutral location, so the Stone Creek at 82nd was sort of defined as fair ground, if you will, because there was a lot of, frankly, bad blood between some of the Dryhootch folks, people here, the veterans that had stood up Dryhootch and the VA. We were supportive of the fundamental ideas of Dryhootch, but how they were putting some of those things into action was really scary for us. So there were risk management considerations, there were reputational considerations for the VA and for the medical college. All of those issues that we had, Dryhootch said, those matter to you, but they don't matter to us and they don't matter to the veterans that we serve. And so that was a very complex set of conversations that had to happen. And frankly, Mark talked a lot about deprogramming. He said, look, I just spent the last 2 years deprogramming you from sort of the traditional large healthcare perspective to how things are on the street, working with real veterans. We ended up saying, we don't know that we want to play in this space. Right? And Mark and I actually ended up about a block from here at Roman Coin arguing about whether or not the partnership was going to be sustained over time.
On Brady Street, we were having an argument which got pretty loud because I felt he was saying something like that I didn't understand. But then we stopped, took a breath. He finally got what I was trying to say, and I almost got what he was trying to say because, I had to learn how academic minds really work.
The veterans have this idea, I've got your six, I have your back, right? And that means that no one is left on the battlefield, right? Or somebody's going to come and get you. And I think we realized that we were playing by a set of rules that work for us as institutional partners. Those rules are not the rules that nonprofits play by. And if we were going to be serious about doing outreach with veterans in the street who are in crisis, who are abusing drugs and alcohol or having mental health crisis and who didn't want to come in the door of an ER at the VA, we were going to have to learn how to be there for Dryhootch. I think we had developed something that I would call blind trust. Right? I have no idea why the partner is asking me to do something, but I'm going to do it anyway.
We've disagreed, we've argued, to the point of maybe even the partnership being dissolved way before it probably even had a chance to get going. But what I really liked about it is we all stuck it out. Leadership allowed it to happen, and we were able to finally come to a consensus without getting mad at each other and walking away. It was kind of from that point forward where I thought, he means what he says.
We couldn't be in sort of this place where we're constantly threatening to remove ourselves. And so that's the point in time, I think, in the partnership where we said, we are all in. We're here for Dryhootch as a nonprofit agency that's trying to serve veterans no matter what, whether they do good or bad, whether they fail, whether they succeed, whether they ultimately dissolve as a nonprofit. We will be here through to the end. And so we have been there through and through. And I think one of the things that happens as a result is the nonprofit agency begins to see that your goals are truly aligned with theirs. That's not saying that we have perfect alignment, but that we're coming into more and more alignment over time. And that changes the fundamental relational structure. We have the big guns. We have multi-million-dollar endowment at the medical college, right? We can make things happen on the ground if we choose to. But having that money and having the relationship are two different things. It's really easy to write about it. It's another thing to walk the walk.
If you're a small organization, partnerships are huge. We know a piece, but there's these other folks over here and over here that are experts that have been in pieces of that field for a long time. And one is the medical college. And how do we bring their knowledge to help the vet on the street who's living under a bridge?
Everything that they were initially proposing wasn't going to be able to get done. But I personally was very intrigued by the idea of a Dryhootch, a place that would be substance-free, alcohol-free, where veterans could come and go, they could feel supported, they could be surrounded by their peers. So it could be supportive but not therapeutic in a professional sense. But I was realistic enough to realize that VA can't possibly provide everything. I think what was happening was that for the veterans in the Vietnam era and earlier eras, they wanted to be able to make a contribution in service not only to veterans of their own eras.
I crashed and burned. I had drunk driving tickets. I was in jail. I ended up in a mental institution because of PTSD. And when I came out on the other side, there were a million reasons why you and I shouldn't be talking today. And so I couldn't just go back to whatever a normal job means. I figured I couldn't redo the clock, but I could maybe stop some of the Iraq and Afghan vets, the newer veterans, from going down the same path we did. I got together with some other vets who came to my aid when everybody else pretty much wrote me off and formed Dryhootch.
Dr. Jeff Whittle, the sort of lead researcher from the VA that's a part of this partnership, sort of stepped aside in some ways to allow me to write a set of grants.
It turns out that on another project, the Legion project, Leslie was working with us, and she became interested in veterans. Zeno, by that time, was a faculty member and sort of integrated Leslie into this project.
Zeno asked me at that point to come on as his co-investigator, and I said, absolutely. I said, you take the tech stuff and I'll take the educational stuff. We assembled a multidisciplinary team of clinicians, educators, veterans, veteran family members, mental health providers, and we all came together to identify reintegration topics. We, for 3 years, really rallied around this idea of a peer mentorship curriculum that Dryhootch could own and disseminate and use for training future peer mentors.
The academic partners participated in the development of further grants and brought us technology such as the iPeer app to support outreach and peer support connections with veterans.
We're hearing stories from veterans, and truly Gino kind of helped me to go to the next level, to think about how technology can be used in this particular area, mental health, particularly risky behavior. The other thing is that I teach students, I prepare students. So here in this project, about 3 to 7 students are involved. They are interviewing, they are building systems, testing, working with them. So that was an amazing experience for them, so that they are really ready to develop not only this kind but also similar stuff which is has an impact in real life.
This partnership has really given me an opportunity to develop my own research in arts-based methods and to use the arts as a way to disseminate findings into the community. And I think one of the overarching goals, even though it was kind of an unwritten goal of this partnership and of the projects we've been doing, is to bridge that military-civilian gap. And with the arts, it's so accessible to everyone. And the veterans, they get so excited about it because they can share their voice and share their experiences in a way that others will understand and in a way that kind of connects people on an emotional level. And I wouldn't have been able to do that had it not been for this partnership.
Gino taught me a lot about community research, community relationships, made me better at it. So I'd like to say he helped me grow a lot, and his ability to write because I don't have that ability to write in that world. We were able to get published, and he was able to put my ideas down on paper that made sense for the rest of the world to see, or a combination of our ideas.
Learn from others, be willing to challenge your thinking. There can be moments where we may be less comfortable with each other, and so finding ways of connecting has been really critical. We started in conversation with one another about ideas that we had for working across institutions and with our partner Dryhootch to see what we could do to improve academic life for students who come to universities such as UW-Milwaukee and use their GI Bill benefits to help them pursue their educational goals. Bob was someone who, through Dryhootch, helped connect their space on Brady, and our students became baristas, and that wonderful way of learning with veterans while serving them good coffee.
We're live right now. Facebook Live. January 2250. So my name is Tim Wolf. I'm here at Dryhootch to help out with the QRF app and the peer support program that's the partnership with Dr. Zeno and Medical College of Wisconsin.
Our partnership was able to help people. When I first was going out to the medical college, it was like going into a hospital in some ways. It was uncomfortable, but today, I just go. I don't worry about stuff like that anymore. That has actually helped me grow into not worrying about I'm no different than anybody else.
And we wouldn't have kind of come to this understanding of, in a sense, not personally shared experience, but a set of shared experiences more broadly, without these weekly conversations. I think for researchers, we typically have sort of a pre-prescribed notion of what we want to accomplish. And now, I think after 7 or 8 years of this work, I'm very attuned to when I say something and a community partner gives me back different language, they usually are being intentional about it, right? It's not a mistake, it's not an error, it's not that they misheard me, it's that they're telling me, you're close, but it's more like this.
Out of this partnership, I think, to me, was the most wonderful thing is actually it created a friendship. And to me, that was a special part of this journey for me because I made a really good friend. It's been a fun journey because of our collaboration and partnership. It almost, I want to say, it's almost a family.
Guitars for Vets today. Free guitar lessons today. Free guitar lessons from 2 to 5. Come in, get some lessons. It's for the vets. We're here to support you.
It's a lot of fun too.
Yeah.
Yeah, a lot of fun.